Today, we're going to talk about vitamin D dangers, which is very different than vitamin D toxicity. They're not the same. It's extremely rare to develop vitamin D toxicity, which really involves only one symptom: too much calcium in the blood. Hello, this is Dr. Peru, a nutritionist by profession. So, according to Professor Bruce Hollis, who is the pioneer in vitamin D research, you would have to consume hundreds of thousands of international units of vitamin D3 for months to develop any toxicity. And a lot of times, people are afraid of even 10,000 international units. It sounds like a very large number. But I want to show you something right here. See this book right here? This book is called The Pharmacological Basis of Therapeutics. And I want to read something on page 1687. The maintenance dose usually ranges between 50,000 and 250,000 units daily. A few years later, if you look at the textbooks, it's down to between 400 and 600 IUs. Maybe it just worked too well and they had to take it out. I have no idea, but in order for vitamin D to work, it's dependent on magnesium. If you have a magnesium deficiency and you take a lot of vitamin D, you are going to exaggerate that deficiency because the more vitamin D you take, the more magnesium you need. Both of them synergistically work together. Even if we think about the main problem with vitamin D toxicity, which is too much calcium in the blood, take a look at this research paper right here. Magnesium prevents vascular calcification. Magnesium is a natural calcium channel blocker. Too much calcium can cause clots, and guess what? Magnesium helps to control that process. Number 2. Zinc and vitamin D. Zinc, the vitamin D receptor, is dependent on zinc. When you start taking vitamin D and you're slightly zinc deficient, that deficiency can be exaggerated because the requirement of zinc goes up when you take more vitamin D3. What are the symptoms of a zinc deficiency? Your taste is not quite right, or your smell. You may get acne or flaky skin, or even lower amounts of testosterone because zinc is needed to build up testosterone. Vitamin K2 and vitamin D, this is another one you should take. What is vitamin K2? It helps to prevent the buildup of calcium. The other function is to drive this calcium into the bone and the teeth. The last nutrient, vitamin D and vitamin A coactor for vitamin D3, is vitamin A, and I'm talking about the active form of vitamin A called retinol. The receptors for vitamin A actually sometimes bind with vitamin D receptors as a complex. They both work together. If one of them is lacking, the other one won't work optimally. Vitamin A also helps keep calcium out of your arteries. If you become deficient in vitamin A, you're going to notice that it's hard to see in the dark at night. You potentially can have dry eyes, dry skin, lowered immune system, maybe even some acne. I'm going to bring up 3 additional things on this topic. Number 1, I always recommend taking vitamin D3, not vitamin D2. It's not as potent. It's made synthetically. I would avoid it, and I would definitely avoid taking any synthetic vitamin D3. You want to get a natural source of vitamin D3. And lastly, many manufacturers, when they make their vitamin D, have hidden maltodextrin, or they might put in glucose syrup. They put this starch as a filler. They use it because it's a very cheap ingredient, and most companies that sell vitamin D3 use these fillers. There's a very simple way you can test this. You open up the capsule, mix it in some water, okay? Add a few drops of iodine, and if it turns dark purple, suspect a starch. This is called the starch test, and you can detect hidden maltodextrin and other starches in your supplements. If it doesn't have it in there, it'll just turn yellow or just slightly clear. Let's go back to food sources of magnesium. What are the foods high in magnesium? Anything leafy green, because green is chlorophyll. And at the heart of chlorophyll, you have magnesium. Also, you can get magnesium in chocolate. Just get the one that doesn't have the sugar. If you're going to do chocolate, and also magnesium is in certain nuts, but I would be careful about consuming too many nuts. Pumpkin seeds have a lot of magnesium. And if you were going to take a supplement, I would take magnesium glycinate. Magnesium glycinate is easily absorbed, and I would take 800 or more. I've known people who needed to up the magnesium like 2400 milligrams to get rid of their cramps. Zinc. Where do you get zinc from? Red meat. Shellfish are two very good sources. And if you're going to take zinc as a supplement, make sure it's also in a blend of other trace minerals, just to make sure that you don't create a copper deficiency if you take it over a long period of time. Vitamin K2, let's say, for example, you're doing 10,000 IUs of D3, then I would recommend you take 100 micrograms of vitamin K2 for every 10,000 international units of vitamin D3. And the version of K2 I would take would be MK7. You can get it from high-quality grass-fed butter, kimchi, sauerkraut, consuming grass-fed beef, eggs, and then we get to vitamin A. Vitamin A is not beta-carotene. Beta-carotene is in plants, vegetables. Don't try to get your vitamin A from vegetables. It's not going to work. I highly recommend you try to get your vitamin A not from a pill, but from food, egg yolks, liver. But my favorite source is cod liver oil. Why? Because cod liver oil not only has the omega-3 fatty acids, but it also has a nice balanced blend of vitamin A and vitamin D together. Thank you for watching this video. If you like this video, do not forget to subscribe and press the bell icon button so you don't miss any new videos.